Good afternoon. My name is Calvin Phillips, the Vice President of Student Affairs, Dean of Students. And I want to welcome you to the panel discussion about some key support offices that we want to share some information with you. Before I begin, I just want to say to the group that this is kind of deja vu for me because about a month ago, I was at the college where my son is a freshman doing Parent Weekend. So it's, I understand what it means to be sitting in the seats that you are in and prepared to ask questions and listen about the kind of support and the networks that are here to make sure that your student is having a positive experience here at the university. So to begin with, I'm going to have each one of the panelists to introduce themselves, meaning their name, pronoun, role, and office. And then after that, I'll begin to ask them a series of questions. So would you like to begin?
Yeah. Hello, everyone. Is it on? Hello, everyone. My name is Sohail Achevain. My pronouns are he, him, his. I am a manager at the Disability Resource Center, and I'm really grateful to be sharing space with you all today.
Hello, I'm Michelle Trumpy. I use she, her, hers pronouns. I'm the Director of Public Health at Boynton Health.
Hi everyone, it's so good to see all of your lovely faces. My name is Mari Weigel. I'm a licensed social worker with the CARE program with the Office for Student Affairs, and my pronouns are she, her, hers.
Hi everyone, I'm Lexa Plika. I use she, her pronouns, and I am the Prevention Program Coordinator at the Aurora Center here on campus.
Hi everyone, good evening. My name is Nina Hernandez-Baizan. I use she, her pronouns, and I'm the Diversity Liaison Counselor with Student Counseling Services.
Okay. All right, the first question. I love this question. What drew you to want to do this work, and what keeps you there? So let's begin on the far end.
Great. We'll alternate back and forth. I start with the hard ones. The name was an easier one, but it's fine. Yeah, so I love this question. I think it's something that we often hear from students, like what brought you into higher ed, and for my role specifically working in mental health work. And really the answer to that was when I was an undergrad, it was a really difficult time for me. I experienced a lot of challenges. There were a lot of systemic barriers that were kind of getting in the way of me being able to learn and to be able to engage in community. And I had a few really important key support people that helped me be able to get through that time, and they really made a lasting impact for me and for my loved ones that were around me. I think part of the things I noticed were people that were actually caring about me as a person and not just doing it because it was a part of their role. And I was really interested in being able to come back to the university. I didn't come here for undergrad, but to be able to come here and be a part of this really important time of development in young people where they're asking so many important questions about identity. How do I make sense of the world? How do I think about family? What do I want to do with my future? And for me to be able to be a support person that they can turn to, I can help process with them as they're going through some really big shifts and changes. And so I think what's kept me here and kept me in my work in mental health has really been my office sees mental health in a really broad way. So we're not kind of tied into a really narrow view of mental health is only one-on-one individual counseling, but we really see the way that us as a community here are able to support one another in our mental health. So I do a lot of support for peer mentoring programs. I do outreach events. I just got done teaching a class on the sex ed class you wish you had in high school. So I get to do a lot of really cool different types of strategies to support mental health from a more preventative lens as well as a more one-on-one individual lens. So that's what keeps me here, and my colleagues who are also really dedicated to the work.
Yes, so as a reminder, I work at the Aurora Center, which is our campus sexual violence resource center. When I was an undergrad, I didn't go here, but in my undergrad experience, I was a student activist on my campus in the area of sexual violence. And so that really opened my eyes to ways in which organizations can support people to navigate systems better. And that's what we do at the Aurora Center. We are advocates, so we are confidential and trained And that allows us to do a lot of different services within the university and to help folks navigate difficult situations or just answer questions about things they might not know. Sexual violence and particularly prevention are fields that are ever rapidly expanding, and we're always learning more every year. And so it was just very cool to kind of shift tracks again in college. Again, I had questions too of like, what am I doing and where am I going, right? And once I had that experience, I knew that not only did I want to do sexual violence work, but I wanted to do that in higher ed, particularly with students. And one of the reasons I get to enjoy staying here is because our office is pretty great at reaching out to students in different populations on campus and letting them know what their rights are, what their services are that they have. And I think it's just a very unique experience.
Hey everyone, it's Mari again. I work with the CARE program here with the Office for Student Affairs. So essentially we're just a group of folks who help students get connected to mental health resources, whether that's on or off campus. And we also support folks with access to basic needs. So if anyone's experiencing food insecurity, financial insecurity, or housing issues, we also provide support and resources for them as well. I would say, when I was an undergrad, that was really my first real encounter with having some difficult mental health situations that I experienced. It was the first time, and just, trying to make sense of the world and being away from home. It was just a really difficult time for me, and so that was what I would say sparked my initial love for, counseling and mental health support. And so just having that be such a pivotal time in my life, I just realized how important it was to have these kind of services in schools. But then as I got older, I pursued a social work licensure, and so that helped me get more experience in the higher ed realm, such as doing student counseling and helping folks, figure out which resources to access and how. And so that just lit a fire in me. I was like, hey, I love this. Like, y'all are fun. I have fun with you guys. Like, you all are super relatable. So I just found myself being able to just feel like myself in this space, but then also helping others just let them know that what they're experiencing is relatable and it's valid and it's real and it hurts. But, we're here to support everyone.
Hello again, I'm Michelle from Boynton Health, and I have a master's in public health from the University of Minnesota. And during the welcome week, I got a little stress ball that's actually still in my office, and it's a globe, and it said, "Study public health, save the world." Yep, that is absolutely why I went into public health. That's why I'm still in it. It's really important from my perspective to look at issues from a systems perspective, and systems that are helpful and systems where there may be barriers for people to experience their highest level of health and well-being. That's really important to my own individual story. I grew up in a multi-generational household, and I'm a first-generation student to go to college in my family, and so I can really relate to that experience and know the systems that were helpful to get me to where I am today, and maybe the systems that need to be dismantled in order to help our students today. Why do I do it here at the University of Minnesota? These students are brilliant. They have so many amazing ideas, and this university has so many amazing resources to help students get to where they need to go. And I'm newer in my role, but it's been truly an honor to work here with your students.
And again, my name is Sohail Achavein. I'm a manager within Student Access at the Disability Resource Center. I really appreciate hearing the reflections of my colleagues. I think some of the things that I'm hearing is how our offices honor intersectionality, and the lens that my office works through is addressing that disability is a key aspect of someone's diverse identities. And the University of Minnesota not only has a commitment to acknowledge that, but a commitment to address dismantling ableism. A lot of the work that we do, let me back up. We are the largest DRC in the United States. We are chock full of resources and connection for students to not only address developing compensatory strategies when it comes to disability barriers, but also we look through a lens of accommodations. The work that my colleagues and I do within Student Access would be the implementation of individualized accommodations to support mitigating some of the things that our students may experience, but it's also educating the institution, really thinking critically around faculty members' individual pedagogical approaches, the spaces that we design, the policies that we implement. We need to be thinking about how these things can impact people, and specifically our students with disability diagnoses. I've been with the university for over 17 years. I started as a student employee, actually, an access assistant, so I worked one-on-one with students with disabilities. Disability identity has been integral in my life from inception, and I think where I'm at right now in my career is focusing on supporting the institution and addressing, again, systemic barriers related to students who are navigating our campus with disability identities.
Okay. Well, thank you, each and every one of you. The next one you should be able to do pretty quick, because I think some of you already hinted on it already. 60 seconds or less. Summarize your office. That's a challenge. Okay? Who wants to go first?
I can start maybe. Maybe 30 seconds. I shared a little bit. We are housed within the Office for Equity and Diversity, and we champion that. That's really rare at a Big Ten institution. And why that's really important is we're housed with other resource centers that honor and work to support individuals with marginalized identities. Many people don't think about disability when we're thinking about a disenfranchised identity, and we work to support students in addressing ableism. And our office supports in many capacities. For some students, it's individualized accommodations. For others, it's connection to resources. I work really closely with my colleagues, honoring a person's whole person in addressing some of the individualized barriers. And we support undergrads, graduate students. We are one of the DRC offices in higher education who also support staff and faculty. So we're communicating to all of you, we're communicating to your students, we're communicating to the institution that disability is an integral piece of who someone is, and we need to be working to address the barriers that we as an institution pose for our students.
All right, we'll just go down the line. So I'm from Boynton Health, and Boynton Health is one of the largest campus health services across the country. We offer a full range of clinical services, and I have some notes because there's just so many that I want to share with you. So primary care, gender care, we have the Go for Quick clinic, which is like a minute clinic. We have urgent care, comprehensive dental services, sexually transmitted infection testing. We have physical therapy, we have nutrition from registered dietitians, we have an eye clinic with an optical, we've got a lab, we've got x-ray, we've got pharmacy, we've got travel clinic, immunizations, mental health therapy and psychiatry, and we have public health. We have pause, pet away worry and stress, where animals come to different spots on campus and students can hang out and just take a deep breath and relax. We have our Nutritious You food pantry. We've got Go for Chauffeur from a safety perspective. Our main clinic is located on the East Bank, right behind the Union. And then we also have services in St. Paul, and we also have a new West Bank clinic as well. And our typical hours are weekdays, Monday through Friday, 8 to 4:30. And we also have the Office of Student Health Benefits. And so that is who provides the insurance plan for students on campus. And probably the best part of all is that students can access Boynton at no cost to them. There's a few services that might have a very low cost associated, but it's really premier care at just the right cost.
Wow, I work here and I am stunned. I'm like, look at these people. Wow. All right, so again, my name is Mari. I'm with the CARE program, which is housed under the Office for Student Affairs. So essentially, we are the main reporting service on campus for any kind of student concern, whether that's health and well-being or mental health or academics. We're kind of that initial spot where, faculty and staff or any professional person can consult with us about how to provide support to students who are, struggling or displaying, some kind of unhealthy behavior. So we work closely with faculty and staff, helping them navigate dynamics in their classrooms. And we also have the ability to meet one-on-one with students. We are an invitation-only office, so we send out letters and we say, hello, student, I'm Mari. Happy that you're here. Sounds like you may be having a hard time. I'm available if you need to meet with me. And then students can either say, hey, great, I'd love to meet with Mari, or they can say, this is not a good fit for me. So we give, we honor the self-determination that all students have to make their own decisions, whether that's a good or a bad decision. And then, of course, we also work closely with our other campus partners here on this panel to kind of funnel them to the next part of their journey. So lots of initial concerns that we help students with, and often that first introduction to what is mental health and what am I experiencing, what am I feeling in my body, and how can I find some relief for this. So lots of referring and directing them to that next best step in their journey.
Amazing. At the Aurora Center, we serve primarily survivors of sexual violence. We also serve everyone on campus. So undergrads, grads, staff, faculty have access to our services. Concerned persons of folks who may have experienced sexual violence. Our services are broken down into two main buckets. The first bucket is prevention, which is my side. I'm the prevention program coordinator, and so that's doing things like going out and working with faculty, staff, graduate students, undergraduates in their respective departments or student groups, whatever it may be, and doing a variety of workshops and outreach events such as this to let people know about our services and break down the issues of sexual violence. And then the second half, which is what I think a lot of people typically associate with a sexual violence center, right, is direct service. And so that's offering a variety of services to students who have experienced sexual violence, such as immediate crisis counseling. We have a 24-hour helpline and advocates that will go out and do hospital calls. There's legal advocacy, housing advocacy, academic advocacy for folks who are struggling and need a little bit of grace and lenience with their classes while they're going through a tough time. There's lots and lots of things that we do that I can't quite fit in this time, but those are some of the key highlights. So we're always open to questions from folks, whether that's about policy or just services in general. So we're very much in the business of referrals to many of our partners who are up here today.
Great. Again, my name is Nina. I work at Student Counseling Services. We call ourselves SCS for short, so we love an acronym. And so we offer free mental health support to students. Free, always free. That's a really key part of why students find us. And so we offer a variety of different types of mental health support. Kind of the main one that a lot of folks think of is individual, ongoing counseling. We do short-term counseling, so that means that we meet typically every other week with our students, and we do have some session limits around that. And we're able to see that a lot of students are able to really work on their challenges that they're having within that. Sometimes we'll have folks come to us who maybe have some ongoing challenges or really struggling pretty intensely with their mental health. So we also do similar to what Mari does, where we get folks referred into community providers for mental health. One of the unique pieces about our office is that we don't bill insurance at all. And so again, completely free. Sometimes students have some concerns about insurance. And so we're able to not have to go through all of those hoops and able just to support our students. The other kind of areas that we work in is we have a really robust group program. It's actually been really cool to see over the pandemic the ways in which we've been able to meet people virtually and grow really beautiful community that way. And over the last few years, we've developed a lot more affinity groups. So we have identity-based affinity groups. We also have counseling groups for students that might have experienced a specific thing. And so, for example, we have groups for students who may have lost a parent or sibling. We have groups for students around chronic pain. And then we also just have interest areas. So we have like an anxiety group, a group for students who are interested in learning more about how they can be involved in their community if they identify as a Black individual. We have an affinity group for Asian folks. We also have a mixed multiracial group and a Latinx group as well. So a lot of different group programs. Again, those are completely free to students, and it's really beautiful to see the connections that can happen there. We also have a service called Let's Talk. So Let's Talk is an option for students. It's one of the most common ones we'll encourage guardians and families to talk about with their student. If your student is a little bit hesitant to come to counseling, Let's Talk, they're able to fill out one super quick Google form, and then that's all they have to do. They can drop in same day, the hours are on our website, and they can pick which counselor they want to meet with. So sometimes a student might say, I want to work with a counselor with this identity or with this experience, and they can pick. Mari is one of our counselors at the Let's Talk program. We have a really good team of folks who do that work. And so in the Let's Talk, they can talk about a specific problem they might have. Maybe they're worried about somebody else. Maybe they're like, hey, I feel like counseling maybe should be a thing I do, but I'm like, I don't know about it. So it's kind of like a first experience they can have, and then we can get them connected to the right spot. And then we do things like this, where we do prevention. We also do talks. So we'll go out and build relationships with different community partners and talk about mental health all around the U.
Okay. Next question. When might students want or need your office services? So Mari, why don't you go first?
My pleasure, Calvin. So students have the ability to access our services. We have an office located in Appleby Hall. Students can come visit us, or they can email or give us a phone call. Typically, it's a good place to start for students who may have no idea where to go or what they're doing, and they may just need a little bit of help of, how about you try this direction, or how about you go over here, or it sounds like you want this, but actually you might want this. So it's just kind of a good starting place for students to come and get connected with us, especially if they are experiencing any kind of first-time, mental health concerns or any issues with basic needs. It's a good spot for us to just work with our colleagues and do some sharing for resources around the community. So lots of different ways to get connected. So if any students are in here, come by, Appleby 205-211.
Okay.
I can go next. So at the Aurora Center, there's a number of ways to engage with us. Services-wise, as I said earlier, anyone can request workshops from us, which is really great. Also, everyone has access to the direct services that I mentioned earlier. There's also ways for students and staff and faculty sometimes too to get involved as volunteers for us, either doing violence prevention work, going out and doing workshops, or direct service work, learning about how to do helpline calls and hospital visits. And we also do lots of consultations with all sorts of folks from different departments and parts of campus. We're also in Appleby Hall, and we can be reached by phone. We have a 24-hour helpline. We have very active email and text line as well, so we're pretty accessible that way.
Great. So we often will see students, they're usually reaching out to us when they're starting to notice that they might be struggling with their mental health. And so oftentimes they're actually hearing that message from family members, and so you all are such an important part in that, where you might start to notice that maybe your student is telling you kind of over and over again, like, I'm really struggling, like things are feeling really difficult, I'm not getting a lot of sleep, I feel really down. You might notice your student is kind of just presenting a little bit different than typically they would. And mental health is a little tricky sometimes in that there's kind of like an invisible line of like, maybe I'm struggling and that feels okay, I'm kind of managing, and sometimes it kind of pushes over into this place of like, okay, like I'm actually really struggling, it could be helpful to get some professional help. And so I would say we oftentimes see students who are coming in and are really proactive. They're like, I know mental health is important, get me signed up, like I want to get support proactively, so that's lovely, we love to see that. We also have folks come in like November, December who are really, really struggling, and we're so glad that they come in and we're able to give them support in that time too. And so we'll kind of see folks come in through our brief consultations where our counselor will meet with them for 30 minutes and make a plan with them about what type of mental health services are going to be most helpful for you, and we get them kind of sent to the specific place. Oftentimes we keep them with us, or if they need more intensive care, we'll get them supported and work with them in that process. So I'd say you all are a really big help. We oftentimes in those brief consultation meetings that I do, I'll hear like, yeah, like my mom said I should probably get some help, so like here I am. And we're like, okay, great, like glad you're here, like let's talk about how we can help get you some support. And then you can check us out on our website. I did bring some cards too, so I'm really happy to be a direct contact. I'm happy to take emails, but otherwise you can find us on our website too.
All right. So why might people go to Boynton? Well, first of all, your student could call our nurse line and talk through whatever they're experiencing, and we could direct them in the right way. If they're feeling sick, 'tis the season right now, right, where people have coughs and colds and they're not really sure, is it COVID, is it flu, is it strep, is it mono? Come to Boynton, we'll help you figure it out. In that situation, we have COVID PCR testing, barrier-free. Just come on in and get it Monday through Friday on the East Bank, and we have it 3 days a week in St. Paul as well. We have Gopher Quick Clinic. Again, that's that minute clinic. You're going to get your testing right there and find out your results and move along. We have urgent care where people can walk right in and get that kind of testing. And we also have primary care appointments as well. Urgent care also, things happen. Student maybe is skateboarding out on the steps. I've seen that a lot, and let's say they fall. They can come into urgent care and we can help take care of them. Students might come to Boynton for their routine visits. I was actually just talking with a mom who was talking about getting her daughter set up, and I said, why don't she go to Boynton? She can get all of her care taken right there, and it's a great opportunity for that self-efficacy and starting to take care of yourself and making your routine medical appointments and dental appointments. And then also just from that public health perspective, if your student needs a safe ride on campus in the evening, they can call our Gopher chauffeur. If they're needing some additional emergency food resources, they can visit our food pantry. And then again, since I'm public health, I'm just going to have to put in a plug for if they want to protect themselves and those around them, they can come to our flu clinics that are around campus. We're offering the COVID-19 bivalent booster as well. So those are just a couple of reasons that people might find themselves at Boynton.
This again is Sohail from the Disability Resource Center, the DRC. We like to say that we invite students to our 30-minute consultations if you have a disability or you think you have a disability. I know the questions in advance and I don't want to skip ahead. But a big barrier that many students, a big barrier to coming to our office is students thinking that they need a diagnosis or they need documentation from inception of connecting with an access consultant, and that is not true. Many students might have a disability diagnosis. They may know of what their academic barriers are, and some of them don't, and that's okay. Our consultants are there to work with students to support them in addressing what are those barriers. Is it related to housing? Is it related to you being in the dining halls? Is it you accessing space? Is it you related to meeting attendance requirements, meeting your assignment deadlines? And then also, if a student has a 504, an IEP plan, so you maybe had accommodations in the K through 12 environment, we can chat with you about how those things may apply in the higher education realm and the nuances related to how those accommodations may translate. And then lastly, being as proactive as possible is really important. Creating a framework of through my office, framework around accommodations you can leverage when you need them is really important because we cannot require faculty to grant retroactive accommodations. So an accommodation letter, I feel, is an act of social justice. It's communicating to your faculty, to the institution, that they are creating a barrier, and accommodations are there to support in mitigating the barrier if you need it. The majority of students with whom work with our office, they might not leverage their accommodations, but they're there in case they need them.
Okay. Something often misunderstood about your office. Who didn't get a chance to go first?
I can go first. All right. Well, there's a few things that people might not know about Boynton if they haven't had the opportunity to come to a session like this. One is that the wide variety of services that we offer at Boynton. So that is really important to know. The second thing is that we are available for all students regardless of insurance status. And sometimes that part can be confusing. Students are required to carry insurance as being a student here, but we don't tell you what kind of insurance. So students might be covered under a family plan, or they may choose the plan from the Office of Student Health Benefits. Either way is absolutely fine at Boynton, and either way there will not be charges to students who pay the student services fee. We bill insurance, and then whatever isn't covered is covered by the student services fee, so there is not going to be a bill to students, except for just, there's a few minor things like getting glasses from the optical center or durable medical equipment or things like that. And Boynton is happy to talk through that and make sure that people understand all of that. The other thing is that even though we're located on campus, all of our providers are fully licensed professionals in their field. So it's not student workers at Boynton providing the care, it's fully licensed professionals in their field.
Okay. So I shared one of them. There's two, I think. I shared one is that we do not require documentation upon inception of connecting with our office, and that's really important. I could talk for hours around how securing documentation is its own barrier for students, and we function around the social model of disability, which essentially talks about how we as a community, culture, institution, we create the barriers. It's not the people with disabilities. The other thing is that a pillar of ableism is that disability looks like something. We most certainly support individuals, students who have apparent or visible related disabilities, but the largest number of students that we support, which is salient outside of higher ed in the world, are those with mental health diagnoses. So many times students come and say, I didn't know you worked with students who have depression or anxiety or bipolar or other potentially non-apparent conditions or invisibilized disabilities like Crohn's disease, diabetes. We most certainly do. So disability doesn't look like something, and we want to have a conversation with students to understand, so how does the university impact you?
I'll take it this time.
We were both like,
What's the question again? I already forgot it.
The question is, something often misunderstood about your office.
Thank you, I appreciate that. Let's see, I think something that's misunderstood about our office, and this of course happens to me in my profession as a social worker, we really do have the awesome opportunity for people to come to us in their really vulnerable stages, when they need help or even if they need just advice or consulting. But those situations can be so hard because we can't fix all of the problems. I think right now in our society we are facing a lot of lack of resources in our community post-COVID, and just living in a world that's not necessarily post-pandemic, but, you know, suffering the consequences of that. And so I think it's hard when, you know, you want to be in a position of having the opportunity to fix everything, but unfortunately we can't make these problems go away. But of course we're here to support you, we're here to be present with you as you experience those difficulties, and we'll do what we can to guide you on to the next best thing. But sometimes time is the thing that works against us when we're hurting and we want those things to be fixed quickly rather than having to wait for things to make way.
Sorry, I can go. We'll get wild. Here we go. Yeah, so I think one of the main things that comes to mind for me is my mental health issues aren't bad enough for me to seek support. I think a lot of times people think it has to reach some certain type of level. And us as humans, I think we do a lot of kind of like pushing down, like how much actually am I really struggling? And so that's like one of the most common things that I hear people say, like, I don't know if what I have is bad enough. I don't even know what I really need to work on, but I just know I'm really struggling. And so we really welcome those folks to come in and really believe that we can help support them. I think another thing is we'll often have students who have tried counseling in the past and may have had a negative experience with a therapist, and they might have this idea like counseling or therapy is not for me, it's not helpful. And in my previous work, I worked as a children's mental health case manager, and I've been in front of probably 100 therapists, and we're really different. Like one person to the next is really, really different. Our styles are different, the way we were trained is different, what we care about, our values. And so I often have people come in and say, like, I'm giving this one more try, but like I tried and it was not helpful. And we really work to help that be a corrective experience for the student where they're actually able to have an experience in therapy that's helpful for them. We do satisfaction surveys with all of our students we work with, and every year I'm like really proud to see all of the work that my colleagues are doing and really hearing how we're able to provide really good support to students. And then also sometimes someone's just not a good fit, right? Like you might be a really good therapist, you might be a really good student. For whatever reason, it just doesn't mesh well. And so we have mechanisms in place to be able to get people to a different therapist that might feel like a good fit for them. So those are two of the pieces I would say. And then the third one is sometimes students are worried about confidentiality. They worry about if I come in, is my teacher going to know? Are my friends going to know? Is this going in my student record? We take confidentiality really seriously. And so it's all of our records are kept separate from student records. We have to get written permission in almost all instances to disclose any information about your treatment. And we do a lot of discussing with students about what are the exceptions to that. And so we make sure that they feel secure with their information that they're sharing with us.
Yeah, so some similar things for my office as well. So at the Aurora Center, I would say there's maybe 3 main things that we would like people to know about us. The first is that anyone affiliated with the U can access our services. So that's not just undergrads, that's graduate students, faculty, and staff. The second is who our advocates are. So I think advocate is maybe not a term that a lot of people are familiar with, right? They might be more familiar with social worker or university staff, right? But we're part of the university, but we're not social workers, right? We're not lawyers, we're not social workers, we're not counselors, but we're able to help people navigate those types of systems. We are trained and we are confidential, meaning that we are separate from a different office like Title IX, which is here is EOAA. And then the third thing is, again, confidentiality, right? Some folks might call us and say, like, is this recorded, or is my information going to get out there if I share some information about a sexual violence incident that I've either experienced or have knowledge of? And the answer is no, except for certain very specific instances of harm to others or child sexual abuse, right? And so that's just 3 things that we would love for people to know. I think we do a pretty good job of communicating that clearly to folks, but sometimes folks who are new to the U do have those specific questions when engaging with our services.
Can I add another one for your office that I've come across? I think sometimes folks think that they have to have had a recent sexual assault, or it has to be like within the last week. And I know that your office does a lot of really good work with things that have happened in the past too. So that's something I always like to share with folks too.
Yeah, thank you for adding that. Yep, so folks can really talk to us about anything and everything relating to sexual violence, right? And one, I guess, misconception or myth is that sexual assault, right, like a physical contact is the only form of sexual violence. Our office handles all sorts of different types of sexual violence, including sexual assault, but also sexual harassment, stalking, and domestic and relationship violence. So kind of everything under that umbrella of the sexual violence term.
Okay, great. Okay, this will be the last question for the panelists, and then we'll open up to questions from the audience. And the question is, recommendations for how students can connect with your office.
I can start. Shameless plug, we are looking for volunteers right now. So if your student wants to get involved, they can get involved with us that way by applying. But if they're just looking for services, the website's the easiest thing to do. It's always updated. All of our information's up there. They can stop by. We do take walk-in appointments as well. So folks can come in, schedule an appointment with an advocate, or get some just kind of immediate help if someone's available. So there's lots of ways to find us and get involved if they're curious about our services, have questions about things, or are looking to get some immediate help.
I can go. I would echo the piece around the website. So if you tell your student to Google Student Counseling Services, UMN will pop up right there. Like I said before, we often will do that 30-minute brief consultation with students to kind of get them in the door. But Let's Talk is a really good way that they can do same day. We have a little bit of a wait for the brief consultations, and so it's nice to offer that Let's Talk option also. And then all of our groups are also listed on our website. Many of those you don't need to be in ongoing counseling. You can just fill out a Google form, and so you could send that link to your student and be like, hey, do any of these groups look of interest to you? And they're welcome to sign up on our website that way. And then we've also found that especially when students are pretty hesitant, sometimes it can be nice to do what we call like a warm handoff. So you could be like, hey, I went to this panel, I saw Nina, she talked about things. I think it could be helpful for you to meet with someone. And so I'm really happy to take direct referrals that way too. And then I can do the brief consultation with your student if that feels like it would help them get connected into services. And like I said, I have some cards I'm happy to pass out at the end.
So just like my other fellow colleagues, the website is the go-to place for us as well. It has information about our program, bios about my colleague and I if you want more information about us specifically, and then just the wide variety of services that we offer to students and families and staff and faculty as well. Otherwise, for getting in contact with us directly, we do have an email address that we have eyes on during the business hours, Monday through Friday, and so that's probably the quickest way to get a hold of us. And then we also do have, we have a phone, so if you prefer to call and talk, but you never know what Gen Z, what they're thinking about the phones. So really, there's just many opportunities for you to get connected with us.
All right, there's lots of ways to get connected with Boynton. You could call us. You could call the nurse line. You could call the appointment line. We have, for appointments, there's patient portal, and your student would have access to that to make an appointment. You can also find us on the web. We have a website that details all of the services we offer. We also have several active social media accounts, and that's great for time-sensitive information. Great for parents, too. What's Boynton talking about on Facebook or Instagram or Twitter. And then you can drop in. You can drop into urgent care, no appointment required. Or you can also, in our pharmacy, we also have a small retail pharmacy with deeply discounted items. I had a headache the other day at work and went down and got some Aleve for $3. It was amazing. And students have access to that same thing too. I also brought some cards that have just the different resources at Boynton in case that's helpful for people.
This is Sohail from the DRC. I collaborate really closely with my colleagues. So before I talk about how to connect with our offices are often working in collaboration with each other. I just recently chatted with Mari this past week in terms of referrals to students. So we try to de-silo our offices as much as possible. So sometimes students find their way into a specific resource office after they've connected to another. At the DRC, we are located in that kind of goofy Death Star looking building across from the TCF Bank Stadium, the McNamara Alumni Center. We have drop-in hours every day where students can connect or parents can connect with access consultants, confidential conversations. We offer 30-minute consultations as well. And if students know they want to register, we offer an opportunity to set up a registration appointment. We just want to connect with you to talk. Yeah.
Okay. At this time, raise your hand if you have a question, and then I'll have someone come up with you with the mic so that we make sure that everyone hears your question.
Hi, good afternoon. My name is Tony, and I'm trying to find out, is the university doing, or does Boynton Health Center, do you guys offer COVID vaccines, and what are you doing to let the student population know about that? And then the second question is, can you talk a little bit more about the chauffeuring service that you have?
Yeah. Those are great questions, Tony. The first one is about the COVID vaccine. Yes, absolutely. We offer the COVID vaccine. We offer the primary series, Pfizer primary series in our pharmacy, and people can make an appointment for that. We also offer the bivalent booster on campus. We have several mass clinics that offer Pfizer, and you can look online and make an appointment for that. Otherwise, we also offer the bivalent booster in our pharmacy as well. And if people are looking for the bivalent booster and the flu shot at the same time, efficiency, the pharmacy would be the place to go for that. We do a lot of communications for our students around COVID safety precautions. We have a campus public health safety officer, Dr. Jacob Tolar, and he's sending messages to students about ways that they can keep themselves safe. Also on the topic of COVID, also want to mention that we offer high quality masks at all of our residence halls at Boynton if students need access to them, and we also offer antigen test kits for free at the residence halls or Boynton or through the pharmacy. The next question was about the Gopher Chauffeur, and that is a free service where students can request rides from places on campus to their home in the evenings. It runs 7 days a week, and it starts, I think it starts at 8:30 on Monday through Thursday, and it goes till midnight. I'm going to double check my hours. And then on the weekend, it runs later. It runs... hold on, I have that. I want to tell you more exactly. But the Gopher Chauffeur is run by an app, and so you can get that app on your phone, and you can request a ride, and the wait times are pretty limited, and it's a service that's run by Boynton, but 2 students would come in a van. The van is labeled Gopher Chauffeur, would pick you up and take you where you need to go. Yep.
As a parent, I'm thankful for the university providing those care service to our kids. I have 2 questions. One question is, I would like to know that if the kids is experience some kind of the depression or anxiety because the final or something, which office we should reach out to for help? Yes. And then second question would be like, for the kids with like some disability, or I don't know, for mental, some mental disability like ADHD, what kind of the support the university provide us, and which office we should reach out for help?
All right, so maybe I'll start with the, they're both related. Thank you for the questions, I really appreciate it. We at the DRC, we focus kind of around a holistic approach. So my colleagues can speak to this, but I would be referring, if a student has a diagnosis and they can identify a barrier related to their ADHD, for example, maybe they have barriers related to showing their knowledge under time constraints. The largest accommodations we provide are extended time and semi-private testing spaces. I could continue talking about how the institution asks students to show content knowledge, which is its own barrier. We invite students to be thinking about this holistically. It's not, oftentimes academic accommodations are never gonna be the one thing to mitigate disability-related barriers. People need to be addressing developing skills on top of potentially leveraging accommodations, which is where my colleagues come into play. If someone has performative-based anxiety during finals, it's high pressure, and there's the time barrier, we would refer a student to seek a support services, maybe utilize effectiveu.umn.edu, and my colleagues can speak more about that. Incredible skill building resources in tandem with potentially leveraging academic accommodations. Some initial thoughts.
Awesome, thank you for that question. So I would say there's definitely a couple of options for you, which is good. We won't give you just one answer, we'll give you many. So definitely my office with the CARE program is one of many resources to provide support for students who are experiencing maybe depression or anxiety or difficulty in those classes. We can kind of help funnel students to what might be the next best step for them. So if the student is presenting and they're saying, they might want to try counseling, or they're interested in some kind of therapy, or they're interested in trying out medication, or just getting more information about what it means to be someone who is struggling with mental health, then we can provide that initial set of education about kind of some of those next steps, and we can refer to our campus partners here like Nina with Student Counseling Services, or with Boynton, we can refer them there. Otherwise, if for whatever reason, maybe the student is wanting more of a specific service that we don't offer, I have a ton of connections with folks in the community, and so we can refer outside. So even if folks are wanting to get in to appointments sooner, or if, again, they just have maybe a specific identity that they can't find that support on campus, we do have the opportunity to get them connected to support somewhere.
Yeah, I'll add into, I think it's often where in these heightened times of like midterms or around finals, there's like an extra amount of stress that's happening. And so I think Let's Talk is a really good option at that point, because your student is able to get support that same day and talk about, okay, like what are the challenges that I'm facing? How can I actually make a logistical plan to kind of manage some of this anxiety around whatever high stress moment might be happening? And then again, if we're seeing like, you know what, actually I think ongoing counseling might be helpful for you. All of our Let's Talk counselors are master's level trained counselors. We can then, similar to what Mari's saying, help get folks connected to more ongoing. But I think kind of both with Mari and also with the Let's Talk program, we're able to do some problem solving right there in that moment that's really helpful. And then I know Boynton has the crisis, right? So there's lots of good options for you.
Yeah, and I was also going to add, I appreciate what Mari said about there's a lot of options. So in addition to the therapists that Boynton has, we also have psychiatry services if medication is part of the plan as well.
Sort of a follow-on question in a way. To the last one, if you have a student who is suffering mental health issues, but doesn't feel they can actually come and talk to anybody or even make contact, is there a way for us as parents to let you know, and then so that you can then make contact and just they might come and talk to you if they go. I mean, I heard you mention about an email that you might send and invite them in. So is there a process for that? If we say, okay, this particular student, I know that he needs to come in and speak to you, and maybe a number of you, and it would really be good if you could just somehow be persuaded, to come in, and I don't want to go and sort of drag him in because he's got to make his own decision. But I sort of feel that with the right invitation, he would come in, and then it would start the process. And as a parent, is there a way for us to sort of get that started, or not?
I can go ahead and take that question first. So thank you so much for that, and I think you highlighted some really good points about some of those initial barriers of seeking care and how uncomfortable that can be. For sure, you have the ability to, so I collaborate a lot with Gavin Gribna, who is, the reason why we're all here today for this student family parent weekend. And so we kind of work hand in hand. So he takes concerns from parents, and if it is related to maybe their student who is wanting or needing more support, then they will come, then he'll just, shoot me an email. And we are right next door to each other, so it's always like, hey, Gavin, how are you doing? And so really what that looks like is we're extending an invitation to these students. We're introducing ourselves. We're kind of letting them know up front, like, this is what our office does. For transparency purposes, we only reach out to students if we can name a reporting party, because we never want students to feel like people are talking about them. We never want students to feel like, things are going on behind their back that are uncomfortable. So we kind of try to be as transparent as possible. My philosophy of 2022 is clear as kind. So we just like to be upfront with that right away. So as long as, parent is okay with, being named in that letter of, mom and dad are, worried about you, and, they want to make sure that you get support. So we do that. And again, our office is invitation only. So, just a little bit of what you mentioned, the self-determination can be so, so tricky. And that's something that we're always navigating our office, is that balance of care and concern. And so if there's not like an immediate risk for harm, then we don't require a meeting. We don't do a wellness check. We kind of go through a series of steps to make sure that the student is connected. So we send that initial email, introduce ourselves, invite them in for a meeting. If they live in housing, I have a good relationship with our housing folks, and I can say, hey, would you mind having, some folks check in on them, some of the CAs, our community advisors. So just kind of trying to loop in the support around them, or sometimes I'll send a message to their advisor who who helps with their academic experiences, and I'll say, hey, sounds like they could use a little bit more support. Would you mind checking in? So I think it's, doing what we can to build that community of support around them, because it's there, but, when you're going through hard things, you don't always notice that. And I think, just doing what we can to make sure that we're kind of planting those seeds over and over, so the student will be like, oh, hey, I've heard of the CARE program. Fine, I'll go make an appointment. So it's kind of just a lot of that ongoing exposure that we rely on with students. There was a question over here too. It happened pretty soon.
This will be a quick question. So for student that is not 18 years old yet, can they book the appointment for their vaccination? For the COVID and the flu vaccination?
Oh, for COVID.
If they are not 18 years old yet.
If they're not 18,
Yeah.
yes. Yep, they can still book.
Okay.
Yes. Love to give you the info after.
Thank you so much for the information you're giving us. So I have a question on how do you advertise all these great, resources that is in campus? How do you reach the students? There are students here who are maybe from other countries, or maybe the parents are not aware of anything. How do you reach them out so they can access the resources freely?
Yeah. Yeah, I can start. So it's such a good question of I think sometimes it's we have so many resources, it's hard for students to know okay, where do we go, or what do these offices do? And so within Student Counseling Services, we have a whole outreach team that's devoted to this. I'm one of the members, where we go out and we do panels like this. We go to classrooms. We have a lot of partnerships with offices that might be more likely to work with students. So for example, MK, which is the Multicultural Center for Academic Excellence, or ISSS, which is the International Scholars Office, where maybe students, there's a little bit less stigma in working with those offices. We do a lot of partnering with them for them to pass us direct referrals of, hey, the student struggling we're working with, and they'll kind of funnel folks through us. So we work a lot with our colleagues there. We'll go out to Greek Life and do presentations within Greek Life. And then we'll also go to kind of bigger campus events. So Welcome Week, we pass out a lot of flyers. We try to show up wherever we can. And then we also have social media. So we kind of try to do an approach where we talk to students, we talk to families, and we talk to our colleagues, because oftentimes we're getting referrals directly from our colleagues. Like Sohail was saying, often the student will land in one office and we're like, oh, there's actually 2 or 3 other offices that are going to be really helpful for you. So we all maintain really good relationships in that way to be able to support your student.
Something that Boynton also does is we have health advocates who live in each of the residence halls and Greek houses, and they are peer resources for students to go to. I got a cough and it's been going on for a few days. What should I do about that? Or my throat really hurts. What are my options? Or I got this cut and I need a Band-Aid. I didn't pack any from home. So those are all questions that our health advocates can help with, and can help do very basic triaging, and can help them get to Boynton if that's the resource that they need. The health advocates are trained. They gather every week in a class format and learn about different issues that they might encounter, and they have an opportunity to consult about the various issues that they're seeing in their settings with a provider at Boynton.
The Less Talk program, for somebody who has severe social anxiety, do you ever do that virtually, or does the person have to drop in physically?
Yeah, great question. We do virtual. So we have virtual options, and we also have in-person options, just for that reason. We know some people feel more comfortable accessing virtually. One of the other things I forgot to mention about Let's Talk is you don't need to be located physically in the state of Minnesota. You can be anywhere around the world. And so we've had a lot of international students or folks studying abroad come to our virtual Let's Talk option. So it's a really great resource that doesn't have some of the barriers that come up with ongoing counseling just because of licensing laws.
Interesting. I have sort of a follow-up question. My son lives in a dormitory, and he's got really bad social anxiety. He was given a single room, so he doesn't have a roommate, and I think he's extremely isolated. And I remember when I was in college, I know you guys don't call them this, but back in my day, they were called RAs, the people in the dorms. What are they called here again?
CAs.
CAs. What is the role of a CA? Do they ever interface with you guys? Because when I was in college, they were kind of looking out after kids, and making sure that they were participating and belonged and this kind of thing. And it doesn't seem like that's the role here, or no? Or does that have nothing to do with what you guys do?
I could say from the, go ahead.
Go ahead. No, go ahead.
I was going to say, a lot of what my fellow panelists were sharing is we do a lot of outreach. The Disability Resource Center meets with all of the community advisors every year to talk about the Disability Resource Center, the intersection of disability and part of identity. So we do interact with them. In my experience, is a lot of the community advisors, that is the role that they take, and they are their own students. And I know that they're guided and shepherded with their own resident hall director. Maybe you can speak more directly to that.
No, what I was just going to say is usually, and I'm speaking from someone who doesn't directly report housing, but usually they do all kinds of training with them, which some of these panelists up here probably have people from their area work with them and connect with them so that they can provide that support for the students and as CAs so that they can interact with the students on those floors and everything. So, but I don't want to speak too much because really, like I said, probably should have somebody from housing who could probably give a better in-depth understanding of what their role, what their expectations and things.
Well, I'm just would a CA ever report to you about a concern about a student? Has that ever happened?
Yeah, so the CAs essentially work really closely with our resident directors. So as far as I know, so I used to be a resident assistant at another university when I was an undergrad. So yeah, the whole RAC, I was like, what's this? But I know the CAs typically don't work too independently from the resident director's discretion. And so if there is any area of concern, they will funnel that to the resident director. And oftentimes the resident directors, they're also professionals in their field, so they are equipped to address these concerns themselves. So sometimes they don't need to come to our office, but I also still get referrals from Housing and Res Life. And then I also send messages to Housing and Res Life to say, hey, would you please have a CA check in on this student and then, report back to me with an update. So there is communication that's happening, but, it can vary based on, the residence hall and all those different variables.
Okay, thanks.
There's one in the back and one up here.
Hi. I first want to thank Disability Resource Center. I have an anxiety and Crohn's girl. So you guys were great over the summer with getting her set up with everything she might need. So I just want to say, even if you don't think they're going to use it, it's like this parachute that she can pull if she feels like she's falling. So it's really great to have them there. So thank you for that. She also, though, is trying to hook up with a counselor on campus. And I guess I'm not clear which one of you she should go to first to get a long-term counselor. She has one at home. She can do it virtually, but she'd like to start seeing someone face-to-face. And I'm just curious as to which one of you she should go see.
And when you say long-term, does that mean that she's not wanting to do kind of like every month, once a month or every other week? She's wanting like a years-long relationship?
She was just looking for someone, she was seeing someone every 2 weeks.
Sure.
And she's just looking for someone to touch base with and have an email of that if she's having an issue or a down patch that she can talk to.
Yeah. Yeah, all right.
Yeah, so I'd be happy to also answer that question. Thank you so much for that insight. And then, side note, I love the image of the parachute. That's really beautiful. So yeah, I'd be more than happy to meet with them to kind of help get them in that right direction. As Nina briefly mentioned, our counseling services and Boynton as well have awesome options on campus, but sometimes whether that's the length of time, as it is primarily a short-term service, and even just the need of students on campus as well. Sometimes it can be harder to access when it comes to wait times. So I'm more than happy to be someone who steps in and, can support students during that, kind of waiting period, but then also getting them connected to like off-campus resources that may have just different availabilities, especially if they are looking for more of that consistent long-term relationship that maybe they can even have throughout their time here at the U. So there are definitely many options, but I would say myself would be a great option to get them connected. And if you'd like to connect with me afterwards, I'd be happy to do that. Don't want to tell you too much information because lots of good questions around here, so thank you again.
Thanks, Wanda.
Great. Maybe our final question up
Yes.
front.
Thank you. You guys have done a great job. We're truly very impressed. My question is, I am thinking that this is a big school, and some kids are very sensitive. Every family and every children are different. I'm a father of 4. This is the last one here. A few years ago, when my daughter was a freshman at Harvard University, she was struggling because she came from a small school. And she was struggling with the grades because she did not know somebody gets a B, because she was used to getting A. She was really struggling. So she could call home 10 o'clock at night. We couldn't fly from here to Boston. It's too far. But as a parent, a freshman, 3-4 months old, you have left out of state. It was very stressful for parents. But we were able to reach the closest person, a protractor. The residence hall, like CLA, whatever you call it. I remember to call her at night, about 11 o'clock. I say the exact same problems that she's going through. But I told her, please do not tell her that her father called. Because their kids are very sensitive. Oh, my father is just calling. It's a 911. Father to call 911. So I told her not to, But actually, she did not. But she sent resources, somebody closest to her. Where she sleeps, she referred her all through without knowing there was a parent behind. And it was very successful. 2, 3, 4 weeks later, she thought, oh, you know what? Somebody reached me. Somewhere miraculously, things worked. And she was saying, I think God blessed me to get some resources, things like that. But she graduated successfully. The question I have is, I'm concurring what somebody asked, that if we call for help, some kids don't want to know that the parents are involved. That's the question I'm coming. Some children don't want to hear that the parents are calling behind them. They're very sensitive. So I'm wondering how that should be handled. Because, for example, I know my daughter would not like to know that I'm calling behind her. But I know I have succeeded with the rest when it works. But for you, I hear it's different. So how can you deal with a situation of that nature? Because I, as a parent, it all depends, 2 of us work together to make it successful. Because I do know this kid for 18 years. So if I tell you, you can help better, or each parent says the same, and those who are not sensitive, but those who are sensitive, there's a way it can work. So I'm wondering how that can be helped. Thank you.
Thank you for that question. So I can go ahead and take that and see what else my colleagues have to say. But I think part of what we do is enlisting the community that is around the student as much as possible, and that could be whether they're involved with a kind of affinity group like ISSS if they're an international student, or with a multicultural group, or again if they're living in our dorms and living in housing and res life. Those are some of the or even the academic folks that are involved in their care. Those are the ones who are at least seeing the student and facing them more than I would. And I think we just like to be cautious of, at the end of the day, I'm a random person reaching out to a student, and sometimes that can be kind of scary because they don't know if they're in trouble, which they're not. But we just want to be sure that we're being mindful of, how me as a professional, a staff member at the U, engages with students who may not know why they're being engaged, and so that would be an opportunity for us to elicit the support of the community. So, sending a message to ISSS or sending a message to the Res Life folks and just say, hey, just check in with this student, because, part of the duty of a CA is just to build relationships, build rapport, at least be somewhat of a familiar face. So if they ask, hey, how are you doing? It's not weird or it's not out of the blue. So that's kind of some of the support that we use for students. But in terms of my office, just because of, the reputation we may have as student affairs, it can feel really official. We do like to be cautious about, how we come off to students. But otherwise, like the other campus partners, like they are equipped with those resources. So the CA can say, hey, have you ever heard of Boynton Counseling Services? So they're aware of, what resources they have on campus, but maybe the student needs a little bit more help accessing them, and then they can, of course, come to me that way.
Okay. Hate to close out the sessions because it's been some great conversations. First of all, I want to thank you for each and every one of you coming because that's so important, because it shows that the student that you're here to support, you really want to make sure that you have the resources necessary to do that. And I appreciate you taking the time to listen to our panelists. And I want to thank each one of our panelists for providing us such enriching information. And like they said, please make sure, that if you want to or your student can get on the web pages, and you'll be surprised how much information is out there and available to them for these various resources. We want to see them be successful, and successful meaning is growing, developing, and graduating from the university. Thank you, and I hope you have a great weekend here.